Hello, welcome everybody to Revive Health's daily briefing live for Wednesday, March 25th, 2020. This is our 30-minute review of the latest, most important news, resources, and advice for health system marketers and communicators who are dealing with the COVID-19 crisis. I am Chris Bevelo, Health System Practice Lead at Revive Health and your host for the show. I am joined, as always, by Chase Kleckner, Senior Marketing Manager at Revive Health, who is also our show producer. Hey, Chase.
Hey, Chris. Good to see you.
Good to see you again, sir. And today we're joined by Kristen Huss, who is Engagement Manager at Revive Health. Hi, Kristen.
Hey, Chris. Thanks for having me.
Yes, thanks so much for being here. We are going to talk all things Google in a little bit, which I think is going to be really important for folks. So thanks so much for being here.
Yeah.
So as with each show, we plan on covering the latest news on COVID-19, how it relates to everything you're doing, try to point out some great resources, all that good stuff. We also want to open the floor to questions, make this a forum for folks. So please use the question queue in Zoom. You can put your question in there anytime during the podcast, and we'll get to as many as possible at the end. You can also use the chat function of Zoom if you want to talk to other attendees. And we also use the chat function to post links that we reference throughout the show, so you can access those immediately. Of course, those links will be in the show notes, as well as a recording of the episode at our website, Think Revive Health. We usually have that up later in the afternoon. You can go to Think Revive Health /COVID-19 for all of the podcast recordings. And Chase, we are working on making this a podcast format in which folks can subscribe. We're still trying to figure that out, correct? Is that a fair way to put it?
Yeah. Basically, iTunes takes a couple of days to approve a podcast show.
Okay.
So once we get through those couple of days, it'll be up and live, and we'll make sure to reference it and share a link once it's up.
Yeah, perfect. Because we know that, we're trying to do that. We're not trying. We're doing it every day at the same time. So folks can remember if they can jump in, but we know everybody's super busy. You can't always make the show, even if you wanted to. So having it available as a recording is great, but as a podcast aficionado, I know that one of the things I love about podcasts is I can do two things at once. So I can listen to my podcast and I can walk my dog, or I can, do anything. Mow the lawn. I guess I'm going to have to start mowing the lawn soon.
It's that time.
It is that time. I'm in Minnesota. So for us, it's probably a little early to be talking about that. But anyway, so we want to make sure it's as convenient, easy as possible to use. A couple of notes for folks. We go over this every time. We are not experts on COVID-19. We're not experts on coronavirus. So not a place to come for medical or scientific advice, obviously, but we do have opinions, advice, points of view on how marketers and communicators could be managing this crisis. But please take what we say within the context of your own situation, because we're all dealing with this differently depending on how your organization and your community is being hit, which obviously varies dramatically depending on where you're at in the country. So just a couple of those things out of the way, and I think we're off and going. So one of the things that we always want to do first is check the latest count. Again, we do this to try to put all of this in perspective, as unfortunately we continue to see an increase and climb in the rate of the spread of COVID-19. That shapes everything we talk about. And then eventually when we start hitting that peak and coming down the other way, who knows when that will be, but when we hit that, that also will shape everything we're going to be talking about. So we use the tool that was developed by Johns Hopkins, which we've provided a link to. I think everybody's familiar with it. So in terms of the total international count of cases, we're at 441,187 and 19,784 deaths. I know a lot of people compare this to the flu, the regular flu, the seasonal flu. So Chase, let's make a point to maybe look up kind of where the numbers are. Obviously, I don't think we're anywhere close to that yet, and we may never reach that. But it'd be good just to have that as a reference point.
Yeah,
So let's see if we can have that for
absolutely.
tomorrow.
Okay.
And then the other thing we look at obviously is the United States. So, excuse me, right now, the total case count is 55,568, and the total number of deaths is 809. To put that into a little bit of context, yesterday when we did this show, we were at 46,805 cases in the United States. So it's gone up almost 10,000, 9,000 cases since yesterday. And so it's going up fast. It's still going up very fast. If you could see the chart, it's making that hockey stick going straight up in the air. So we're really, as far as at least this count today, not slowing this in the way we would hope. Maybe that's not a surprise given where we were headed. Looking forward to the day we start seeing this slow down. So let's see. Another resource we want to make sure to remind you, we talked about this yesterday. We have a report on a consumer survey we did last week on COVID-19 and how consumers and hospitals or how consumers are viewing COVID-19 and hospitals and health systems. So again, you can get that at our website. I'm going to explain real quick my cough. I had somebody reach out to me yesterday because I was coughing on the podcast. Not COVID-19. It is, I had the flu, the regular flu, coming out of a conference in the middle of February and got through the flu. But this tickle in my chest and this cough has stuck with me that long. And our understanding in looking it up and talking to doctors, because I checked back in a couple of weeks and saying, hey, this isn't going away. That is a potential side effect of the seasonal flu. This year's version of it is that it can be awfully hard to shake the shortness of breath / cough, even though it's kind of minor and I feel fine otherwise. That's just part of the deal with getting the flu. So if folks are wondering why I'm coughing, that is why. So I think it's kind of important to put that out there, given the subject of our podcast every day. So let's just dig in. Kristen, you are here because we want to talk about Google. And obviously, not surprising, like not news, search traffic skyrocketing in all things COVID. So once again, reinforcing what we all know, Google is a primary source for consumers and patients who are looking for information. But there's been significant changes that Google has put in place, which has implications for how we think about the tools we use and the resources we use and strategies like SEM and SEO. We have a report. Kristen and our team have pulled together a report out of what those changes are and how to think about them. We're packaging it up. We should have that ready. And of course, we'll make that available on our website as soon as it's ready for public consumption. But wanted to talk about some of those things today with you.
Yeah, thank you. Yeah, I mean, we know Google owns the space completely, that on a average given day, search volume is through the roof and people are visiting Google and all their many offerings that they have. But now it's just really more important than ever. So we've been focusing, I would say, typically on algorithm changes. That's usually what we're looking at on a day-to-day basis to really understand how is Google using those algorithm changes and how should we be reacting in the healthcare space that we're in. I would say that's a normal thing that we do. But it's shifted a little bit here amidst COVID-19 because we know that Google isn't relying on their algorithm for anything related. So they're actually doing handpicking. They're actually having people going through day and night and kind of monitoring the search queries to produce content that's handpicked. So all the monitoring that we typically do with the algorithm, our focus has shifted. And really our focus has shifted away from that and towards their SEO alerts and towards their COVID-19 alert that they've produced. So recently, we saw that they were producing SOS alerts that we've all seen, whether it's in a tornado or whatever it might be. And they were using that alert to really offer authoritative information. But they recently released a COVID-19 specific alert, which includes an information portal.
So how, I used to be so ensconced in all of this stuff back in the day, back when my hair wasn't so gray. And I've just moved so far away from Google and the algorithms and all the changes. How are they, obviously there's no way they can use human power to review everything that's out there in COVID. Do we have an idea of where they're even, like, they have to be drawing a line somewhere in terms of what they're starting with, I would assume. Do we have an idea of how they're even prioritizing what they're looking at?
Yeah, so within their COVID-19 alert, they're really focusing on what we're saying are authoritative sources, but specifically looking at World Health Organization, Centers for Disease Control, local authorities, state authorities, health authorities. They're looking at reliable news sites as well, but they're really trying to focus on providing information that they know is reliable to people that are searching for it. And following that, you'll still see the regular rankings that we've always seen, but it's just really far pushed down. So they're really trying to focus on what they know and what they want to give searchers. But for us, that creates the implication of all of our information as health systems is getting pushed further down. So we have to be really cognizant about that and how we're really approaching it from an SEO standpoint.
Which is fine, because we can just buy ads, right? No.
You would think, no.
So they've changed that too. So talk about that.
Easy. Yeah,
talk about
so in terms of advertising, they have actually said no advertising on face masks and COVID-related things. So in the search network, when we talk about that, we're saying like no COVID-19, coronavirus, face mask keywords. When we talk about it in the display space, we're saying no content related to those items. And really, they're just trying to prevent people from capitalizing on a public crisis and really continue to push information that they know is valuable. So we have to really think about, we're not only being pushed out of the ad space in terms of COVID-19, but we're also being pushed out in the organic space. And how do we really tackle that so that our voices are still being heard across the board?
Okay. And then what you're talking about applies to search and display networks, right? Not just search.
Yes, both search and display, and their YouTube as well is also banning ads.
Okay. So talk a little bit about what they've come out and try to emphasize with Google My Business, because I know that can be a sore point for hospitals and health systems in regular times in terms of listings and things.
Definitely. So everything else that we're monitoring, we're really trying to consider in terms of how we should be reacting to it. But when Google is going out and saying that you should do something, we should be listening. And in the case of Google My Business, they actually posted an article recommending that businesses are updating certain sections of their Google My Business profiles for a few reasons. We know that Google My Business and Google Maps are very frequented, very used tools, and they want to provide really up-to-date information. But we also know that they have a lot of areas in which you can push out content. So this is a great way. If you can't push out content through your advertising and you're not being seen in organic, this is a great way where you can be pushing out content related to COVID-19 and how your health system is reacting.
Great. So lots of changes, lots of things happening. If I'm a health system marketer, I'm a digital leader, how do I sort through all this? What are my priorities? What are the things I should be doing first and foremost, given all of this?
Yeah, I mean, we've always talked about quality content. That is more important now than ever on the organic side of things. So we've seen consistently for months and years that Google is continuing to say quality content, think about what your consumers are searching for. And that still applies here. People should be thinking about that. But I want to emphasize the fact that people should really be focusing on two things, in my opinion. One, Google My Business, because we know that's where people are going. It's highly visible, highly accessible. We want to make sure that the information we're giving is up to date and relevant, whether it's in terms of hours or changes in offerings, scheduling, internal procedures. I saw one hospital had posted on their Google My Business about changes in visitor resources and what that looked like. But the second thing I would say to focus on is really where you're putting paid dollars. So we might have existing campaigns that we're running. We might have campaigns that we're considering running. We should be really cognizant about how we're changing our messaging there, but also how we're building our brand.
Okay. So one of the things we've talked about in the podcast at some point prior, and we've worked with clients on, is obviously writ large, folks need to be evaluating everything they're doing from a marketing standpoint in terms of relevance in what's happening now. Obviously, you don't want to be out there promoting in any way something that you're no longer delivering, like elective surgery, if you're in a situation where you've stopped elective surgeries or elective procedures of any kind. But one of the things that we've heard and have been talking about is SEM is still an important place to be in terms of non-COVID care. So cardiac care, oncology, orthopedics, assuming that you're still providing care, and to what degree you are, it's one thing to be out in the market promoting, say, a heart center and all the great things about your heart center. That may or may not be appropriate right now. It may be fine, depending on the creative and the messaging, or it may be tone deaf, right? And that's completely dependent on your situation, where you're at, all of that. But almost universally, assuming you're offering the care, staying on SEM still seems like a smart thing, because people really only see those things when they're looking for them. And if they're looking for them and you're providing the service, you need to be there. So that is something that would seem to be still so important for non-COVID offerings.
Yeah, absolutely. And we're seeing that even there are kind of two cases. There might be treatments and procedures and certain service lines that are still very much active, but we have to consider how they've changed. Something I might ask if I'm looking for care is, has this changed? Am I still able to come in? Do I need to schedule an appointment online? Should I be fearful that I might get COVID-19 if I come into the office? Are there changes in procedures and all those different things? So we just have to shift our focus on what we would typically be pushing in terms of messaging, both in creative, but when people are visiting the landing pages, because there are a lot of COVID-19 related questions that people are going to have about some of these treatments that a lot of health systems are still very much offering. The other thing I would say is that we are going to start looking at things that are booked far in advance. So once we hopefully move through this, there's going to be a long line of people booking procedures and surgeries and that kind of thing. So being really cognizant that that's happening, we should be aware of that coming up in terms of SEM.
Yeah, that's a great point. Even before this crisis, marketers, recognize the challenge of being asked to market a offering or a service line from folks that don't have capacity. And it's still, it's just to this day, this has happened as long as I've been in this business, but it still happens occasionally where a marketing effort is put into the market and then folks discover, oh, well, we can't take these people anyway. It's, it's amazing that we still get that far right out in the market and learn that. That's going to be super critical to pay attention to as we come out of this. And we're not near that yet. Hopefully we're near it, but we don't know whether we're talking weeks or months before that's the situation. Because to your point, Kristen, there's going to be a lot of bottled up need. And at the same time, probably supply in terms of what hospitals and health systems are able to do that's mitigated coming out of all of this, whether that's physicians that are sick still, whether that's just it takes time to ramp back up. So we're going to be facing, to your point, whatever this comes, a situation where the demand is going to be high, supply is going to be tighter than normal, even though we may have a lot of openings on our books. It may be tight for other reasons. And we're just going to have to pay real close attention to how we're marketing again, given those dynamics, because we don't want to be promoting anything that folks can actually access.
Absolutely. And I feel like the big focus here should be on your brand and how you're building that, both in the short term and long term. So how we're reacting to these changes, whether it's in terms of our SEM strategies, our Google My Business profiles, the organic content that we're pushing out, content marketing, how we're reacting now is going to have a long-term effect on brand and whether people want to come to us once we kind of get through this. So really focusing with that intent when you're revisiting your strategies right now and revisiting your messaging.
Yeah, for sure. Okay, so anything else you want to share with us in terms of Google? Let me back up. I want to ask you, kind of talked about SEM and that's still 100% relevant, assuming you're focused on things that you can actually do. I would assume the same is true for SEO, even more so, to your point earlier, right? And again, not just with COVID-19 related content, but anything that you're offering.
Yeah, absolutely. And I would say right now the key is to be updating. Whether you're repurposing old content or you're creating new content, that content should be updated frequently, because we know the space is changing quickly, by the minute, hour, day. So really focusing on how you can update that content frequently. Is there supplemental content that we can build kind of based around the COVID-19 alert structure that Google has suggested that gives us additional opportunity to rank? Are there ways that our creative and our content can come to life outside of just articles and additional language? Could it come to life in video clips and infographics? So really considering a lot of the consumer blindness that's also going to be happening right now as people see the same information over and over and over again. How can we provide something different, but still bolster it in those authoritative sources that we're all reading?
Great. So anything else? That's what I asked before. Now I'll ask it. Anything else you want to add? Anything we missed? Any last words in terms of Google or just digital overall?
Nothing new. I would just say it's going to be helpful once we can get this document out. There's a lot of details to kind of map out the specifics of what's happening with Google and what we recommend down to the nitty gritty. I would just say as a takeaway, focus on your Google My Business listings. I think a lot of health systems have not addressed those, and there's a lot of what I would call quick wins in that area. And then really focus on how you need to be shifting anywhere that you're putting paid dollars to right now. And know that within those two efforts, you're going to be changing your messaging and changing your content, and you can use that to then bolster your organic presence at the same time.
Yeah. Okay, terrific. So want to encourage people again to, if you got any questions, we're going to hit at least one, because we have one in the queue right now. But if there's any others, get them in there and we'll try to answer them before we wrap here. The question we have is kind of a sticky one, but I think we can maybe try to address it a little bit and then spend more time specifically on how to deal with it tomorrow, given the guests that we have, and I'll speak to that in a second. The question is, what are we hearing from our clients and others in the industry about the financial situation hospitals and health systems are experiencing? So we're starting to see news stories about the financial strain that hospitals are having. And primarily that's, in one hand, that seems like, how is that possible when we're so busy, we're so, some of us are, I don't know, overrun is too strong of a word, but we're seeing obviously folks coming in from COVID. And we're the top message we're hearing, the top concern is we're going to run out of beds and we're going to run out of supplies. So how is it possible we're going to run out of beds and supplies, but then also be in trouble financially? Well, the primary reason is because of the crisis and hospitals and health systems doing the amazing thing that they're doing, which is all hands on deck to deal with this crisis. They're stopping the other stuff that they can stop. And primarily, like we said, that's elective procedures, elective surgeries, that type of thing. And as we know in this industry, that so often that care, those cases, those volumes are the ones that financially allow us to do a lot of the other things that we do where there isn't enough financial return to support. So like primary care is an example where you may or may not make money, quote unquote, on primary care, but it's supported by other things that you do. Well, if you cut off the other things that you do, that could lead to financial strain. And we're starting to see articles on that. And obviously this has implications, not just for what this country is facing, because we know the stimulus package, I think, is approved. I don't know if it's signed into law or anything like that, but I haven't even looked at the details, but certainly there's something in there for the health system industry to help with this. But obviously for what we do in marketing communications has a profound impact on internal communications and engagement, helping people understand where things are at, what that means for them. This could show up in terms of issues crisis, where depending on where your organization is at and the things that may be pending or that you're discussing, the media wants to talk to you about those. employees start talking about them to friends or on social media or whatever. So this is, excuse me, this unfortunately is going to continue to be something we have to grapple with. And so tomorrow we have Ryan Coliani back. So I think we'll get a hold of him and ask him to put some thought into how to think about how to deal with that, if that's something that you're experiencing or is pending at your organization, both from internal comms and issues crisis. So I think that's probably the best way to handle that. So I think with that, we can wrap. Does that sound good, Jason, Kristen?
Sounds good.
Sounds great.
Okay, so if there's anything you'd like us to cover, as always, post it in the Zoom chat tool right now. We were going to provide a means to provide feedback on our website. Have we done that yet, Chase? I can't remember.
Yes, it's not up and running yet, but we're looking at it tomorrow.
Okay, so we're going to have a means for you to do that where all this content lives. But as always, you can email me at cab@thinkrevivehealth.com. Again, we're going to have Ryan Coliani with us tomorrow. He was on our first show. He's from our issues crisis department. He leads a lot of our COVID-19 efforts. So we want to kind of check in with him on how things have changed from last week. It's been 1 week. It feels like a lot longer than that. And a lot has changed. So we're going to get his viewpoint. Kristen, thank you so much for joining us. Really appreciate it. Great, great intel for folks.
Yeah, thank you.
And Chase, as always, thank you so much for being my partner in this.
Absolutely.
Okay, so remember to visit thinkrevivehealth.com. There's a banner at the top, or if you want to go right to it, you can do thinkrevivehealth.com/COVID-19 for all of our content on COVID-19, for a recording of today's episode, for past episodes, and all of that great stuff. Make sure you share this podcast with others you think would benefit. And again, as always, keep doing what you're doing. So important, marketing, but in particular communications, so critical to helping us all get through this. So hang in there, you guys. We'll be back tomorrow, and we will talk to you then.